Hi, my name is Sarah Newport, and this is my presentation on ethical dilemmas. In this presentation, I will be going over what the ethical dilemma is, why it's a dilemma, and how it is impacted by professional ethical standards. I will also be going over my own bias towards the situation, how that impacts my perspective. I will go over some scholarly recommendations for this type of dilemma, what I would do in terms of connecting with others about this dilemma, next steps, and my reflection on the dilemma. The dilemma at hand is Breaking Bad or Good, which goes over a therapist named Dr. Jesse Pinkman and his client Skylar White, a 26-year-old professional who suffers from depression, anxiety, and also uses marijuana, which Dr. Pinkman finds concerning. Skylar comes to her appointment very upset due to her friend overdosing from heroin the previous night and has spent most of her day in the emergency room. Her friend almost passed away from the overdose. Skylar feels bad for introducing her friend to her drug dealer who lives next door to her, and the guilt is causing her to want to move away from the dealer as she does not want to cause more harm to others. Police are looking into the overdose, but Skylar does not want to disclose any information to them because she does not want to be involved. Dr. Pigman keeps thinking about Skylar's situation and how he knows the dealer's name and would be able to find his address easily due to them being neighbors with Skylar. He wants to call an anonymous tip about the dealer. He is fighting with his sense of justice and morals and also factoring in the rise of heroin use in the community, so he reaches out for consultation and perspective. Addressing my own personal bias, my family and social circle both have histories of drug addiction. They have, in some cases, been fatal, in other cases, have just been very impactful. But I do have a personal history with that. And I do believe that for communities where drug use is on the rise and becoming a bigger issue, that harm reduction and addiction education is the most important versus simply putting people behind bars. I think if there is such a rise of drug use in the community, there is a bigger issue, and jailing people for it will only cause more people to rise up to fill that empty spot. So, trying to focus on education and harm reduction is how I would like to approach that situation. But again, that is my personal bias. And I also believe that counseling should be a fully safe space. So, as long as there is nothing outlined in a federal or state law or an ethical standard, that what happens in a counseling session should stay within that session. So the dilemma at play here is if Dr. Pinkman should call in the anonymous tip about the dealer in the area where they sold drugs to someone who recently overdoses and is in the hospital. The people in this dilemma would be Dr. Pinkman, who is seeking out advice on how to handle the situation, Skylar, his client, and her friend who is in the hospital, the dealer who Dr. Pinkman has not met or interacted with, but would be calling the anonymous tip about, and the community Dr. Pinkman lives in, as that is driving his sense of wanting to call in the anonymous tip. Some cultural considerations would be how Skylar's background impacts how she views the situation. Does she think this is as big of an issue as Dr. Pinkman does? Would she be concerned about the level of justice he feels about the situation? If Dr. Pinkman has a history of drugs or addiction, is it something he has struggled with or something someone close to him has struggled with, and he feels a high sense of justice due to that? And what kind of community Skylar lives in, and what kind does Dr. Pinkman live in? Are they in a similar community? Is Dr. Pinkman projecting his views on his community onto Skylar's? And just kind of going over how his background and her background could conflict and if he is aware of those biases or not. So this is a dilemma because it's evaluating if Dr. Pinkman's desire to call an anonymous tip about a dealer his client interacts with is going to breach any ethical standards because she has asked to not be involved and he is putting himself in the situation by calling in the anonymous tip. Something to consider is if Skylar would be impacted by him reporting the tip, if anyone can trace it back to she goes to therapy, her therapist might have known about the dealer and could have called in the tip. If it is in any way traced back to her, could it be dangerous for her? And her desire to remain uninvolved should also be taken into consideration, as he would be going against what Skylar's wishes are for this situation. And going over if the tip is anonymous, is it okay? It is something where he would be calling in anonymously. And would that be better for the community? And would it be worth it if it cannot be traced back to Dr. Pinkman? Some professional standards in this dilemma. Some principles for ethical standards would be fidelity and justice. Fidelity, going over Dr. Pinkman's responsibility to Skylar to not disclose what she talks about in therapy to third parties without her consent, and establishing trust and respect within that relationship. Justice is also at play here because Dr. Pinkman is weighing with his sense of justice in this situation. Would it be better for the community and society that he's in overall if he is able to report the drug dealer and potentially get them off the streets? Some ethical standards in question would be informed consent. If Dr. Pinkman had gone over consent with Skylar and what he needs to report, what he doesn't need to report, and he goes against that, it could breach the informed consent and be unethical towards Skylar and their relationship. Another standard in question would be avoiding harm and personal values. While I think ideally getting a drug dealer out of the community would be avoiding harm, also Dr. Pinkman's personal values would need to be taken into consideration. Are his personal values clouding what he feels is avoiding harm for the community and the people that he works with and interacts with? Another standard would be serious and foreseeable harm and legal requirements. The ACA Code of Ethics does go over that serious and foreseeable harm needs to be reported, and it would be depending on Dr. Pinkman's interpretation of if this is serious and foreseeable harm, and if reporting it is preventing that, or if the situation is not serious and foreseeable harm in that sense, and he doesn't need to report it or call it an anonymous tip. Another ethical standard would be reports to third parties and how they need to be accurate. Dr. Pinkman has the name of the dealer, but there's a possibility Skylar hasn't been honest with that name. Maybe it is a different name. He has no way to know unless he asks her about it. Also, he might not know which neighbor the dealer is. It could be her neighbor to the left, the right. Is it a house behind her, across the street? He would need to do some more digging on which neighbor the dealer is, which he wouldn't be able to do without talking about it with Skylar and starting to breach those ethical boundaries there. An article I found about substance abuse counselors and how they deal with these types of situations I found really helpful for this dilemma. So the article I found discussed confidentiality within substance abuse counseling, which ties into this ethical dilemma as Dr. Pinkman is counseling Skylar, who uses substances, and discusses her dealer with him. So informed consent would be extremely important when considering breaching confidentiality. Does Skylar understand what will be reported and would not be? And is Dr. Pinkman calling in that tip breaching that? The duty to warn, threat, and target. Something I found really insightful was when reporting something that is foreseeable harm, there is a threat and there is a target. In this situation, there is no threat of violence being made and there is no specific victim being targeted. It would be a blanket, this person is dealing drugs in the community and everyone could be impacted. And it also went over moral needs versus ethical needs. How does the sense for justice weigh against ethical standards? And does the need to express justice go against those ethical practices? And being able to work within those ethical practices and reeling in that intense sense of moral justice. In terms of connecting with others, I would want to see Dr. Pinkman's moral outrage versus my own and make sure that I'm keeping my perspective in check. I would seek out the perspective of other substance abuse counselors, actually, if they have dealt with something similar, and if they did, how did they deal with it? And seeing what's best for the community versus confidentiality for the client. Do those ethical dilemmas conflict, and how can they be resolved? My next steps to documentation for this ethical dilemma would be for Dr. Pinkman to not call in the anonymous tip as it could breach ethical standards. I would discuss opportunities to help within the community if he feels that he needs to help the heroin use in his community decrease, and also document conversations of what was advised in case he does decide to go forward with the anonymous tip. I do have documentation of what we talked about and what my guidance was. My reflection on this dilemma is being able to call my own moral values to align with ethical standards, understanding what needs to be reported versus what does not need to be reported, and fully understanding that and informing the client of this, seeking out different perspectives before acting, taking actions within the community to combat feelings of not supporting the community enough, and making sure myself and the client understand informed consent. These are my references, and thank you so much.